Chapter 1, Introduction to Medical Terminology. The majority of the word parts in medical terminology are of Latin origin. Some parts are derived from Greek and a few other languages. A word root contains the basic meaning of the term, and it acts as the foundation for most medical terms. They are usually, but not always, describing the part of the body that's involved. Now, sometimes in order to form a word, we have to use combining forms vowels. This combining form will include a vowel, usually the letter O, added to the end of a word root. Usually, the combining vowel is going to make the resulting term easier to pronounce. When two word roots are joined, a combining vowel is always added to the first word root. A combining vowel is used at the end of the second word root only if the suffix begins with a consonant. A combining form is going to be a word root that has a combining vowel added at the end. So a suffix usually, but not always, indicates the procedure, the condition, the disorder, or the disease process. A prefix usually, but not always, indicates the location, the time, the number, or the status. Word roots, as shown here, are combining forms, and again, they usually indicate that body part, but not always. So if you're looking, for example, at the nerve, then we're going to say neuro. If you're looking at the bone, then that's usually going to be osteo. So looking at color, as is provided in your example, cyan, if we add an O to it, cyanosis, for example, means we have a blue discoloration. Eryth, this is going to be red, but if we add that O to it and combine it with the suffix erythema, for example, means we have redness on the skin. Leuc or leuco is going to be the white, so we have leukocytosis or something along that line. It's going to usually have to do with the white blood cells. Melon is going to be black. We have melanus, poly means gray. So again, we just put these with different suffixes to come up with different words that can mean different things. But understand that if you can figure out what the word root is talking about, then we put it together with what we know about prefixes or suffixes. Then we can usually figure out what a word could potentially mean by not knowing the full definition. A suffix is always going to be added at the end of a word to complete that term. Again, in medical terminology, that suffix is usually, not always, going to indicate a procedure, a condition, a disorder, or a disease. A combining vowel will be used when that suffix begins with a consonant. So again, we have neuro. It's going to indicate a nerve. We have neuroplasty or neuropathy. Uh, in medical terminology, some suffixes will change that word root into a noun. So we're talking about cranium. Crani means the skull. Is going to be a noun ending, and when we put them together, it defines the portion of the skull that encloses the brain. In medical terminology, many suffixes meaning pertaining to are used to change the meaning of a word root into an adjective. For example, the word root cardi, we know that means heart. If we add the suffix AC, that means pertaining to. So cardiac means it's pertaining to the heart. When combined, once again, they form cardiac. Other examples of those suffixes would be AL, ARY, AEL, IOR, TIC. Next, with many suffixes, we have a suffix that is going to mean an abnormal condition or a disease. So that would be an example of OSIS. So if we put OSIS to gastra, which means stomach, and we add osis, that means we have an abnormal condition or disease, gastrosis. The combining suffixes meaning an abnormal condition or disease are actually shown in your textbook in table 1.5, and some of those examples are going to be AGO, IASIS, or PATHY. Pathology, the path portion means a disease. Ology is talking about the study of. So pathology means the study of disease. Suffixes that are related to pathology will describe specific disease conditions. For example, we have algia, and this means pain and suffering. Itis means inflammation. Megaly means enlargement. Sclerosis means an abnormal hardening. And then some suffixes are going to identify the procedure that is performed on the body part indicated by that word root. For example, we have centesis. This is a surgical puncture that is done to remove fluid for diagnostic purposes, such as a thoracentesis, where we remove that fluid from the chest, or paracentesis, where we remove it from the abdomen. Graphy means the process of producing a picture or a record. Gram means the picture or the record. Plasty means surgical repair. Scopy means a visual examination. With medical terminology, suffixes beginning with two of the letter R, often referred to as the double R's, can be particularly confusing. These word roots are of a Greek rather than a Latin origin. For example, we have RR, HAGE, and RR, HAGIA. They mean bleeding. However, they're most often used to describe sudden or severe bleeding. RRHAPHY means the surgical suturing to close a wound and will include the use of sutures, staples, or surgical glue. RRHEA means flow or discharge and refers to the flow of most body fluids. So once again, if you can look at these suffixes, you know that these suffixes are going to provide you some really important information. Prefixes, on the other hand, are added to the beginning of a word, and it influences the meaning of that term. Usually, but not always, they are going to indicate the location, the time, or number. but sometimes they will describe direction, quantity, size, and amount. So let's look at the term natal. This means pertaining to birth. NAT means birth. And we add that suffix AL, then it means pertaining to birth. Examples that show how prefixes can change the meaning of this term, we put pre in front of it. Prenatal means the time and events before birth. Peri, when we add that to natal, perinatal refers to the time and events surrounding the birth. Then post, added to natal, postnatal, will refer to the time and events after the birth. Some prefixes can be very confusing because they're similar in spelling, but opposite in meaning. So you really have to look at these carefully. Contrasting and confusing prefixes are listed in Table 1.7 in your textbook. Common examples would be your AB, which means away from, but AD means toward or in the direction of. Hyper means excessive or increased, while hypo means deficient or decreased. So once again, you have to look at these very carefully to make sure that you're not accidentally misreading them. Let's look at a word and let's break it apart and figure out exactly what it is saying. So we have the word otorhinolaryngology. The suffix ology means the study of, so we're going to be studying something. The word root larynge is talking about the larynx or the throat. That combining vowel is not used here because that word root is joining a suffix that begins with a vowel. The combining form rhine with O means nose. So whenever we have RHIN, we're talking about the nose. We do use the combining vowel here because the word root rhine is joining another word root that begins with a consonant. The combining form OT with O means ear. So oat means ear. The combining vowel is used here once again because that word root oat is joining another word root that begins with a consonant. So we also need to double check for accuracy because some terms do have more than one meaning. Let's go back to the word that we were talking about, otorhinolaryngology. That means we are looking at the study of the ear, the nose, and the throat. So now getting back to what we were talking about, double checking for accuracy because some terms do have more than one meaning. For example, let's look at the term lithotomy. On the basis of the word parts, lithotomy is a surgical incision for the removal of a stone. Lith, lith means stone, and otomy is a surgical incision. But lithotomy is also the name of an examination position in which a client is lying on the back with the feet and the legs raised and supported in stirrups. Now, spelling of medical terminology can be kind of tricky, and there's not a lot of people that are really skilled at this. But if you don't know how to spell a word, listen very carefully to the term and then write it down. And if you can't find the word like in a medical dictionary on the basis of your spelling, then start looking for those alternative spellings based on the beginning sound. For example, if you have an F sound, We know that in medical terminology, this might be an F, but it might also be a PH, such as pharmacology, which is spelled PH. A J sound may begin with a G or a J. A K sound in medical terminology. This might begin with a C, a CH, a K, or a QU. An S sound might begin with a C or a PS, such as psoriasis, which is PSO, etc., or an S. And a Z sound may begin with an X or a Z. Accuracy in spelling medical terms is really important because changing just one or two letters can actually completely change the meaning of a word. And this difference literally could be a matter of life or death for the patient. The spelling shown in this textbook is commonly accepted in the United States, but be aware if you were to go overseas, for example, to Europe, the spelling may be different. So just be aware that we're using the United States commonly accepted spellings. A medical term is going to be easier to understand and remember when you know how to pronounce it properly. The Sounds Like pronunciation system uses normal English letters to create words that are familiar. So when you're looking in your book, we are going to outline the sounds of some of the words by using phonetics. So what does it sound like? And we do that with our English letters. A word of caution though, frequently there is more than one correct way to pronounce a medical term. Pronunciation of many medical terms is based on their Greek, Latin, or other foreign origin. But, here in the United States, there's a trend toward pronouncing terms as they would sound in English. And this text, when it has the pronunciation and in your resources, is going to provide the most commonly accepted pronunciation. Now, some medical terms are going to be used to describe diseases and disease conditions, but they can be confusing. Some of the most commonly confused terms are described in Table 1.10 in your textbook. Examples would be acute. This condition has a rapid onset, a severe course, and is usually a relatively short duration. But when we compare that to chronic, the condition is of a long duration. So take a look at some of those confusing terms. There's also some frequently used terms and word parts that are confusing because they look and sound alike. However, their meanings are very different. So pay close attention to these terms and word parts as you encounter them in the text. Some of the really confusing ones would be arterio, which means artery, athero, which means plaque or fatty substance, and arthro, which means joint. Then we have ectomy, which means a surgical removal, and ostomy, which means the surgical creation of an artificial opening to the body. And then otomy, which means cutting or a surgical incision. But then we have the really confusing ileum. When we spell it with an E, it is the last and longest portion of the small intestine. But if we spell it with an I, it's part of the hip bone, but they're pronounced the same way. Another example is mucus, spelled O-U-S, and mucus spelled U-S. When we spell it with O-U-S, this is describing the specialized membranes that line the body cavities, such as the lining of the mouth or the nose. Those are mucous membranes. But when we use it as a noun with just US, this is pronounced again the same way. It's referring to the fluid that is secreted by those mucous membranes. For example, the mucus, OUS, membrane of the nose can produce mucus with the US ending, and it's the snot or the drainage that comes from the nose. Another example is going to be myco, meaning fungus, myelo, meaning bone marrow or the spinal cord, and myo, which is muscle. Another example is don't confuse ologist and ology. If we're talking ologist, this is the specialist of that particular study. When we're talking ology, that is going to be the study of that particular issue. Another one that we need to look at is palpation, which is an examination technique that we use with our hands where we're actually touching the client, and palpitation, which is the feeling of that pounding heart or racing heart. Additional examples include pyelo, which is the renal pelvis or part of the kidney, pyo, which is pus, and pyro, which is fever or fire. So as you can see, there are several terms that can be very confusing. So hopefully you are getting the idea that you have to look at these prefixes or the word roots or the suffixes very carefully, because just one or two letters can significantly change the meaning of a word. And then we have abbreviations. These are frequently used as a shorthand way to record long and complex medical terms. They can lead to confusion and errors, so it's very important to use caution when you're using and/or interpreting an abbreviation. Most of your facilities are going to have policies for the accepted abbreviations within that facility. It's really important to follow that accepted list for the facility where you're working. The rule of thumb, when in doubt, spell it out. There are several abbreviations that are on what we call the do not use abbreviation list. This is published by the Joint Commission. They have an official list of commonly confused do not use abbreviations because these abbreviations have led to potentially fatal medical errors. Example, if we use the abbreviation MS, that can mean morphine sulfate, but it can also mean magnesium sulfate, two very different medications. QD and QOD. QD is daily, QOD is every other day, and sometimes they can be mistaken for each other. If we use U, it actually means unit, but when it's handwritten, sometimes it can be mistaken for a 0 or a 4, and that can drastically change the dosage that a client is supposed to receive. So once again, I want to highly encourage you to start looking at how some of these medical terms are put together. Start breaking them down mentally and or physically to help you learn the different meanings of the words. Look at words that you don't even know and see what types of meanings you can come up with. If there is a word that you come across, once you begin to start breaking it down, then a lot of times you can get a pretty good idea of what a word means without actually knowing the true meaning of the word.